The Nelson Mandela Bay Municipality, working together with the Department of Health, have condemned all misinformation and the spread of fake news concerning the COVID-19 vaccination rollout, as this has raised hesitation among some residents about the effectiveness of the vaccines. Vaccination experts have dismissed claims that the Pfizer vaccine was more effective than the Johnson & Johnson vaccine, which was given to frontline health workers when the vaccination rollout started earlier this year. Dr. John Black, who works with COVID-19 patients at the Livingston Hospital as an infectious diseases specialist, said it was important for residents to take whichever vaccine was available to them, as they both did the same job of limiting severe illness and death in the event that patients get infected with COVID-19.
So first of all, the two vaccines just have different technologies. Okay, so how they take that virus, how they've taken the component of the virus that they want the body to recognize and how they put it into your body is slightly different, but essentially they do exactly the same thing. Okay, the Johnson & Johnson vaccine, you just need one dose of that vaccine, as opposed to the Pfizer where you need 2 doses. They both take information from the virus, and they're both delivered to the body. The body then has a look at that, it then develops the immune response to it, and then it protects you. Because they're different technologies, it just means that you need 2 doses of the Pfizer vaccine to develop that response. It needs to have almost like a small dose up front to get the body used to it, and then the second dose is what you call the booster, to get it up to the level where it really occurs. Now, a lot of the hope around the vaccine was that it's going to prevent infections completely. It does prevent many infections, but the main role of the vaccine is to stop people from getting severe disease. So in other words, if you do get the infection, it's going to prevent you being admitted to hospital, and it's going to prevent you getting into ICU or requiring a ventilator or something like that. As far as I'm aware of, certainly in Nelson Mandela Bay, I'm not aware of any vaccine-related death, any major vaccine-associated side effect, and those that have been fully vaccinated, I'm not aware of anyone who's had severe disease. Those that have been vaccinated and have had infections, as I said, it's early on after vaccination, before the body's had time to develop a strong protective effect. And the real differences are, as I said, just that they're different technologies and they take slightly different amounts of time to work, slightly different side effect profiles, but essentially they do the same job. And it doesn't matter which one you get, you're going to have the same effect in terms of the protection against severe disease.
Dr. Black said it was critical for residents to continue to practice the non-pharmaceutical interventions even after taking the vaccine, as the human body needed time to build up a shield against the deadly virus.
So I think the most important thing here is to realize that there's a period, especially with the Johnson & Johnson vaccine, you can probably go up to 2 weeks, but where you're strongest is probably closer to 4 weeks. At 2 weeks, you've got quite a good response, but after a week, you've got almost no response. So it doesn't mean once you've had the vaccine, you can just go out, take your mask off and carry on. That's not the message. The message here is very much that it's going to take time. Pfizer, because it's got 2 vaccines, the first vaccine, because it's allowing your body time to just get used to it and understand the virus before the booster that dose, it doesn't have much of an effect. It has a little effect, it will provide a little bit of protection, but it's not a lot of protection. You need to wait till at least 2 weeks after the second dose before the protection is at its maximum. So if you understand that your body gets slowly stronger to the point where it's at its maximal protection. So that's why you need to continue to use your mask, continue to socially distance, to continue to do all the things that people have been preaching over this. The main role of the vaccine is to stop you getting very sick.